A number of European countries extended or went back under lockdown as a third wave of COVID-19 sweeps across major cities in France, Germany, Italy and Poland. Concern is growing as the latest surge of cases has been triggered by the more infectious and fast-spreading B.1.17 variant, and making matters worse for Europe is the sluggish pace of vaccinations as the bloc faces severe supply shortages as well as some hesitancy to get the jab. We discuss the situation that's unfolding in Europe, and for this we connect with Matthew DALTON, Paris correspondent for the Wall Street Journal, and Saad Shakir, Professor and Director of Drug Safety Research Unit in Southampton in the UK. Well, a very warm welcome to you both. Thank you for joining us despite the atrociously late hour in Europe right now. Well, starting with you, Matthew, France. Now you're back under, parts of your country, it's back under lockdown as are several other large European countries. What was the major cause of this third wave that you're seeing right now, and what are the biggest challenges in terms of lowering the numbers?
The big cause has been the variants. As you said, the English variant has now accounted for more than 50% of new cases in France. There's also the South African variant, the Brazilian variant, which have been present in the country, though at lower levels. And these variants are very clearly more contagious. They're overwhelmingly responsible for the growth in case numbers. And the big challenge now is this is kind of the third lockdown that France has gone into since the pandemic started a year ago. It's not as strict as the other lockdowns, but one of the reasons for that is because I think the French public is increasingly intolerant of these kinds of measures. And so because the lockdown is less strict, the measures are less effective. So the numbers have not fallen significantly, even though measures have been taken even before this. This new lockdown really doesn't seem to be that different in terms of strictness of the measures. So it's kind of a continuation, and experts are skeptical that that's really going to have an effect on lowering case numbers.
I think all over the world there's a certain sense of fatigue over the reintroduction of lockdown measures, even in Asia as well. And amid all of this, amid the third wave of COVID-19 in continental Europe, Dr. Saad, well, the dominant strain, of course, is the B.1.17. What makes this wave, the third wave, different from the previous two waves in Europe?
Well, I mean, the two things. I mean, COVID has shown ups and downs and waves, and as Matthew has said, the increasing proportion of the new variant, the Kent variant in Europe, it is more infectious, so it is contributing to augmenting that wave. And as was mentioned by both of you, the fatigue which is happening, people not adhering and getting tired to these measures as initially was done. So there is a combination of that. But until we really vaccinate the people of the world, we are going to have waves here and there with various shapes and various strengths until, as I say, we get on top of vaccinating the majority of people in the world.
Matthew, you've mentioned how members of the French public are genuinely feeling about the return of these lockdown measures, but I imagine there's still a lot of worries about the situation. What are they most concerned about regarding the third wave, and are they expecting further hits to the economy?
Well, people are concerned about missing out on life, generally speaking, at this point. I think a lot of people are concerned about the fact that vaccines are not widely available, particularly when you compare the situation in the US and the UK, where the vaccination campaigns have been much faster and more successful. There are a lot of people who want to get vaccinated now who cannot get vaccinated. So that's sort of pushing back, that's dimming the light at the end of the tunnel, I think, for a lot of people. And so, you know, this has been a big criticism of the Macron government. there are a lot of French people, on the other hand, who are skeptical of the vaccine, who don't want to take it. And so that's, I think, to some degree, the position and the policies of the Macron government have reflected some of the hesitancy and the skepticism and the worries of the French public.
Well, there certainly does seem to have been quite a lot of criticism against the French president and his handling and of the latest wave. But Dr. Saad, so if strong variants of the virus continue to emerge, how would this affect people who've been vaccinated already? Will the vaccines have to be updated continuously?
Well, there are different kinds of variants. Variants will occur, as we all know. Some variants don't affect the virus in any way, others do. Variants which we have at the moment, the English variant, there is the efficacy for the vaccines seem to be effective. As far as, for example, AstraZeneca vaccine, I think it's okay with the Brazilian vaccine, but there is evidence that it's not effective with the South African vaccine. So it's going to be a race, if you like, with the variants. At the moment, as we know, a number of companies have already started the work on developing or improving the vaccines for the new variants, and there is a plan by for example, the European Medicines Agency and the MHRA. They agreed a roadmap of what these companies need to do and the kind of studies which they need to do to tweak their vaccines and modify their vaccines to deal with the variants. But variants occur when there is transmission. The more COVID transmits between people around the world, the more variants will occur. So, if you like, the way to reduce the variants is really to reduce the transmission by vaccinating people, social distancing measures, and so on. So, but at the moment, there are a number of projects to deal with the variants which we'll know. But we also know that new variants will arise, and they are arising all the time.
And Matthew, there was recently a scare in European countries regarding AstraZeneca's safety, with concerns over a possible link to reports of blood clots. And that, of course, led to the temporary suspension of the use of AstraZeneca in countries like France, Germany and Italy. Has this back and forth of authorities and the decision to use AstraZeneca affected public confidence in getting vaccinated, especially in European countries where there's already been a high level of distrust towards vaccines?
I think it surely has. It began for AstraZeneca with the clinical trials, where there were problems with the clinical trials, and so the data didn't show whether the vaccine was effective for older people. Now we know it is effective for older people, but there was that sort of cloud that was cast over it at the beginning. Then Emmanuel Macron himself, the French president, fed those worries by publicly speculating that, or publicly saying, mischaracterizing the evidence that there were that the vaccine wasn't effective for older people, which was not true. Now, there's been this back and forth the past week over the questions about blood clots, and the rate of blood clots does not seem to be higher than, for the most part, than the background population. And the US FDA, the AstraZeneca submitted data to the US FDA today showing that was the case. They had the full results of their full trials and no problems with blood clots, and the vaccine was very effective. So, a lot of the doubts about AstraZeneca have been lifted, but there's still this back and forth has cast a cloud over the drug and over the vaccine, and it's not going to be something that I think the public will be mistrustful, particularly in France, where there is a lot of skepticism of vaccines. I think that will last at least for a few weeks, maybe longer.
And Dr. Saad, in addition to vaccine hesitancy, there are also concerns about supply shortage and Now there are reports that the EU might block exports of AstraZeneca vaccines being made at a Dutch plant, and this could essentially jeopardise the UK's vaccine rollout, which has been relatively more successful and on track to its herd immunity goal. How important is the speed of vaccinations to prevent stronger waves of the virus coming, and what do you think should be done to tackle the supply shortage and the hurdles to distribution?
Well, to start with, it's inevitable that vaccines, as the health minister in the UK said, the production is lumpy. It's a very complex production process. It's not producing a chemical. It's producing a biological agent and has many, many steps in the production. So the production is not straightforward. Obviously, everyone knows about the problems that Europe had. Initially, the countries were going to do contracts with the companies individually, then the European Commission took over, and then there were the delays. And now there is the political wrangling about restricting exports and so on, and we hear that politicians, the UK Prime Minister is phoning all other heads of European states, and there's a meeting on Thursday and so on. So hopefully they will reach a solution. I mean, the wisest thing has been said: our enemy is not each other. Our enemy is the virus, and ways to combat it. So hopefully the issues will be resolved. More vaccines are coming, as we know. The Johnson & Johnson vaccine is around the corner, and others are coming. So it is hoped that the problems will be solved. There'll be countries who will vaccinate all their adults earlier than others. I mean, in the UK, they are hoping to do that by the 31st of July. It will be later in Europe. But the earlier we vaccinate, the better. And I really want to re-emphasize what I said. It's vaccinating people around the world, because we could have a divide in the medium and long term between rich countries having vaccinated most of their peoples and poor countries or low or medium income countries haven't vaccinated these peoples, and variants coming from the territories of the world which have not been vaccinated, which will affect travel, affect business, affect tourism, and affect the economy. So the task is really to try to ramp up the production, but also politically to work to ensure that everybody get the vaccines as fast as possible. Difficult, but that needs to be the strategy.
And Matthew, what are the issues that EU authorities are having right now in terms of rolling out these wide-scale vaccinations to get as many people vaccinated as possible? And does it look like their herd immunity target will be on schedule?
Well, I'm not exactly sure. Different countries have different herd immunity targets, so hard to say what the exact target has been. Surely it's been pushed back from what it was at the beginning of the pandemic, or when the vaccines appeared to be available. You know, one of the main problems that people actually have forgotten about, I think, is that there was a vaccine by that is still being developed by GlaxoSmithKline and Sanofi, British and French drug maker, that got severely delayed because there was a problem with the clinical trials. It's now not going to be available until the end of the year, basically, and that was supposed to be a major source of vaccines for the continent. Then you throw that together with the AstraZeneca problems. You know, there's been just some production hiccups. I mean, it's a very challenging process getting producing these vaccines for, you know, hundreds of millions of people in a very short amount of time. So that was an issue. And Europe, they got started ordering the vaccines late. The producers didn't ramp up production probably as much as they should have. The European regulators approved all the vaccines later. So it's just been kind of one thing after another in which Europe, and when I say Europe, I mean the European Union, has been behind both the US and the UK and a few other countries like Israel. So it's been, there's just been a general lack of urgency on the part of European authorities in really going full guns, rolling out, pulling out all the stops to make sure that vaccines were available as quickly as possible. And now Europe is looking at the situation where it's going to be in, there are going to be all kinds of restrictions on life here, even as things are being opened up in the US and the UK.
So there are lots of complications that need to be worked through to get these vaccines out, and political issues should really be the least of the problems that authorities are facing. And well, I'm afraid this is where we have to end our interview today, but that was Matthew Dalton, Paris correspondent for the Wall Street Journal, and Saad Shakir, Professor and Director of Drug Safety Research Unit in the UK. Thank you both so much for your time.
Thank you.
Thank you for having me.
Thank you.
And to our viewers, as always, thank you very much for watching.